Thank you, Professor. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everyone. My name is Dr. Ahmed Jawda from Libya. It is from my pleasure and a great honor for me to present this lecture today about what I should know from cardiac devices under supervision of my mentor, Professor Dr. Merfat Abulmati. I would like to express my sincere gratitude to her for continuous guidance and support. Before we begin, I would like to emphasize and note that all these information in this lecture and discussion and question are presented based on the last international guidelines and recommendation of experts in the field of electrophysiology. The content reflect the evidence-based medical practice is not based on my personal opinion or individual interpretation. Thank you all for your attention, and I hope you find this presentation useful and enjoyable. Uh, okay. First, we will talk about the pacemaker. What is the pacemaker in brief? This is a small implanted device that help treat slow heart rhythm. Pacemaker, why is used? Symptomatic bradycardia, AV block, and sick sinus syndrome. ICD. ICD is the device that monitors the heart rate and treat dangerous ventricular arrhythmia. The uses of ICD, previous cardiac arrest, sustained ventricular tachycardia, selected patient for high sudden cardiac death as primary or secondary prevention of the patient has previous sudden ventricular event, cardiac arrest, considered as secondary prevention or primary prevention if the patient has a family history. CRT, what CRT is? CRT is for cardiac resynchronization therapy, a device that improves the coordination of ventricular contraction in selected heart failure. The uses of CRT, HFrEF, heart failure, reduce ejection fraction less than 35, wide course, especially LBB, in spite of optimal DMT guideline-directed medical therapy, persistent symptom despite the treatment. Frequently asked question. The most common question that the patient who implanted any device may ask. The following slide answer common question from patient and family. First, can I shower after implantation? The answer, follow the wound care instruction from your implant team. Keep the wound clean and dry as advised. Don't soak until healing complete. Keep the wound dry at least 1 week. Don't use plaster cream or talcum powder. Avoid touching the wound. Can I use mobile phone? Yes, you can, but keep the mobile phone at least 15 centimeter away from you as the picture show. I keep in this lecture the picture to any from general population to know even by picture. Can I drive? The time depends on the device, the reason of the implementation, and the symptom. The driving, if you had ICD, always take the advice from the doctor. Can I have an MRI scan? Yes, you can have an MRI scan, and some devices are MRI compatible, but always seek the medical advice from the doctors. Can I sleep on the device side? Usually after the wound has healed and it's comfortable. Can I raise my arm? Yes, you can, but always in the first week, it's the vital week. So don't manipulate more or do more activity in the first week. It is the most important week. So following the instruction, it is very important as shown in picture. Are Bluetooth and Wi-Fi safe? Usually yes. Keep the magnet accessory and the charger device away from the implanted site. What I should carry with me? Always the ID card, medication list, device clinic contact. This is one of the example. Any center, implant device should have an ID card for the airport, for the security, even for example by Arabic محمد سالم السيد مريض يحمل جهاز منظم الحضورات غير مصرح له بالدخول خلال البوابات المغناطيسية. The patient Muhammad Salim Said DD Medtronic, even the card has the company of the device, not allowed for this patient through the magnetic field. Can I pass the airport security? Yes, but always, as we mentioned before, carry your RD to avoid this because it has a magnetic field. Can I use a headphone? Headphone has a magnet. Always don't place or keep it away from the device. Can I use a microwave oven? Yes, normal household appliances are generally safe when functioning properly. Can I travel by airplane? Yes, most patients can. Carry your device card in any travel should carry it to help you and any patient can help you. Medication and even the name of the device and the company is always important because you may at any time need a programming and the doctor will be in dilemma. What is the name or what's the company? What's the type of the device? Always the ID card has these information. Can exercise? Yes, after recovery, start gradually, follow the medical advice, take your medication, and start slow and go. Can I work normally? Yes, most patients return to work, job involvement, industrial magnet, old or high voltage equipment may require specialists. Can I get married and have children? Usually, yes, when you are medically stable, have recovered, discuss concern with your health team. Yes, the device itself does not prevent the marriage or you have a children or have a pregnancy. If you are stable, consult your cardiologist, EB doctors, and you will get uh, uh, these things, marry and have children. Can I go through the metal detector? Yes, the device may trigger the alarm, show the ID card, avoid prolonged exposure to the detector. As we say, you can, but show your ID card to avoid exposure. Can I have a dental treatment? Yes, tell the dentist about the device. Most routine dental procedures are safe. Do I need antibiotic before dental work? Not routinely, because the device alone, the device alone is not indication for antibiotic prophylaxis. Can I have a surgery? Yes, tell the surgeon and the anesthesiologist about your device well before and consult your cardiologist before any procedure. But if you are stable, everything is normal, it's good. Go ahead. What about radiotherapy? It's possible, but require planning and coordination between the oncology and your cardiologist. What about the trans-electrical nerve stimulation? Is the type of therapy and physiotherapy may have some interference before using or diathermy or any electrical machine. So always the answer, consult your doctor before any doing any procedure, but the common question is answered clearly. Are the magnets dangerous? Strong magnet can temporarily affect some device, keep the magnet away from the implantation site. What the signs suggest wound infection? Any patient should know even the sign of the wound infection to seek the medical advice. What the sign by picture and redness, increasing pain, warmth, swelling, discharge, fever, or opening work require prompt medical therapy. As the A picture show the swelling site, We don't know what is the swelling. Is it hematoma? Is it it's early? Is it's the bulging of the device? Picture B, so the retracted skin. Picture C, so the inflammation, erythema around the device. So any patient should know the signs suggest wound infection or hematoma to seek the medical advice. How long does the battery last? It's varied. Device use and regular checks. Estimate remaining battery life, and generator is replaced before the battery is exhausted. So by programming, the cardiologist and the AP doctor can know the remaining battery life. But always the battery is exchanged before it's exhausted. Will the whole device will be replaced? Not all the device will be replaced. Only the generator will keep the lead inside if they are functioning well. How often I do need follow up? The schedule depend on the device, clinical condition. Keep all appointment. It's depend. You are symptomatic. You are stable. Even twice per year. What if I miss a follow up? Contact the device clinic and arrange another appointment as soon as possible. What if I feel a vibration? Contact the device clinic. Some devices provide alert for battery or technical issues. What if my ICD give one shock? If you feel well, contact your device clinic promptly for device. Follow the individual emergency plan. Only one shock does not matter. If the repeated shocks, the second question, the repeated shocks, seek medical advice care as soon as possible, especially if the shock recur or if you have a chest pain, fainting, breathlessness, or persistent symptom. Can ICD shock by mistake? Yes, inappropriate shock is common, can occur. Report every shock so the device rhythm can be reviewed. Can I turn off my device itself or myself? No, never attempt to change or disable the device. Contact the device team. What if the device move or skin become thin? Contact the implant clinic promptly, especially the device become prominent or the skin changes. Any changes, as we mentioned, any changes in the skin, sign inflammation, hematoma, swelling, retracted skin, prominent device, repeated shocks, always seek the medical advice from the clinic, implant clinic. Myth and fact. What is my myth? Myth means false belief. I cannot live normally. It's not exactly. You can live at any like any healthy person. The fact most dial activity are safe after recovery. Myth, every ICD shock means the device is broken. Is not. It's myth. This is false belief. The fact the device may treating abnormal rhythm, but every shock should be reported. When should I seek urgent help? Repeated ICD shocks, fainting, severe chest pain, severe shortness of breath, sign of wound infection. Take home message. Know your device and why you have it. Carry your ID card. Keep follow an up appointment. Inform your healthcare professional. Ask your device clinic when unsure. The ID card should be even when you are not traveling because you may have any evidence or any symptom. You have me fainting. When you seek the medical advice, the doctor know the type of the device and the company that she can bring the programmer and correspond, and you will take the appropriate management. And thank you for attention, Dr. Ahmed Jawda. I hope that was informative and enjoyable.
Thank you very much, Dr. Ahmed. That was very informative. I would like to have this presentation in Arabic, French, and Swahili, like what we did for atrial fibrillation. So I think you can make it in Arabic. We can record it with Mr. Ali, and you can give it to our French team from Morocco. We had Dr. Hussam tonight in the lectures. You can give it to him. And again, we would like to thank everyone who who gets an effort and does an effort to educate the people around, because maybe you can save one life by one single information. I would like to add that for those who have CRT, the medical treatment should continue. If you have any abnormal rhythm or heart rate faster than what you are having, go to your doctor, check your heart, go to do an ECG. Each patient should know his pacemaker or device or CRT or ICD, and he has to know which company is the manufacturer, like if it is Medtronic, Abbott, Serene, Boston, because it's very crucial when the patient has a problem and he goes to the clinic of a doctor that he tells the doctor which type of device he has. Each doctor who implant a device should give the patient this card, even if you write it on a small piece of paper and give it him to be in a hard copy. This is very important for the patient life. Maybe he has an accident and he keeps his card with his ID. Then we can save him by making the device work. Thank you, Dr. Ahmed. And now we are open for questions. Dr. Joanne says thank you very much, informative, Ahmed. Muhammad Adil is saying that MRI should be avoided for 6 weeks after seeds implantation, even if it is MRI compatibility. Yes, Dr. Muhammad Adil, are you the engineer or candidate? Anyway, yes, after implantation, 6 weeks is the minimum the patient has to wait
لا
because. Huh?
I'm a candidate doctor. I'm
ماشي
a
يا
candidate
محمد.
doctor.
ماشي يا محمد. Okay,
Okay.
after implantation of any device, the patient should wait 6 weeks before going to MRI. The device which are MRI compatible, they should go to the clinic of the doctor to program it to MRI mode. Some devices can return to the usual mode after 6 hours or 8 hours from programming, or the patient has to go back to the doctor to have his device back to the functioning mode, not the MRI mode. If you have a patient with pacemaker, he has to go to MRI. Then you program it to non-sensitive mode, which is VOO or TOO, in order to avoid inhibition by the magnetic field. And we have a case, the patient went into MRI, 1.5 Tesla, I didn't make anything. Then he went to 3 Tesla of MRI, and the patient was about to die inside the tube because the device detected these magnetic fields as if they were his own rhythm, and the pacemaker was inhibited. من دكتور كابرال كابي, my son,
Yes,
important.
mother.
Yalla,
Yes,
what is
because
your question?
mother, in Cameroon, many patients they think that as they are having pacemaker or ICD or CRT, they cannot have gastritis, they cannot have influenza, they cannot have yes, arthrosis. Yes,
Hmm.
sometimes they are coming and saying that the pacemaker doesn't work well because they are having arthritis or headache. Sometimes, sometimes it's important to tell them that other diseases are part of the heart problem they can still have. It's very, very important. And they'll be calling you that, how can I have influenza meanwhile I'm having a pacemaker, And you should explain them that really types of sicknesses. Thank you.
That's very important information for African people, that the pacemaker is only working for your heart rhythm and is not
Yes.
working for your whole body. If you are taking
Yes.
medication for heart failure, or if you are taking medication for blood pressure or for your stomach, then you have to keep
To
taking it.
continue.
Another,
Yes.
from Dr. Muhammad Bitar is asking, is dental surgery with ICD Shaila eye off therapy? Sometimes, yes, if the dental therapy is using drill, the drill makes this electrical signal. Yes, you have to temporarily off the therapy, the detection or the therapy of the ICD. But remember, some high risk patients might have VF from the pain or from the adrenaline they use for the dental procedure. So make sure that the patient is safe. Maybe the engineer with the programmer is waiting at the dental clinic in order to work it up immediately after the procedure. Any more questions?
No. Thank you.
Okay.
Lastly, Professor Merfit, your device, your life, your freedom. With the right care, you can live safe, active, and fulfill life. You are not limited.
Okay. Thank you very much, Dr. Ahmed. We are waiting for the Arabic version, the French version, and the Swahili with the help of Joanne, of course. Thank you, everybody, and good night.